Assalamualaikum warahmatullahi wabarakatuh. I will be talking about the second brain that can predict 90% of our health. Would it be okay if you can comment below, and if you are viewing this FB Live, please comment in the comment section your place. If you stay, okay, I will talk about, okay, I have a bonus for you. And it's all about how to help the second brain, okay, be nourished and be managed. Now, there are, I think, 4 steps on how to manage this second brain. And you need to eat healthy food to help your brain work properly, right? But how about this second brain? Okay, the second brain of our body that can predict, can you imagine, can predict 90% of your health. And the science are now catching up with this second brain. Can you imagine how marvelous this body, okay, that our Almighty have created this for your health? Okay, now let me talk about first, before the 4 steps on how to handle and manage the second brain. Let's talk first, what are these second brain? According to the BBC report, I will talk and get more information from the BBC report about the second brain. They are now catching up, and they are now believing that there is second brain. And what is this? Can you imagine? The second brain is located in your gut or in your digestive system. Okay, they now consider this as the second brain. Why? What are the reasons? Here's number 1 reason. Because according to them is that this second brain can predict your health, your weight, okay, even obesity. Okay, they can predict if you get big, if your weight can increase rapidly, and then your immunity, if it goes low, then they can predict that, okay, your immunity is helped from that second brain. And then also your digestive system. If your digestive system is bad, they will only look at that second brain. And what is that? That second brain, my friend, is the microbes. Okay, microbes. So microbes, according to scientists, that almost 3.5 billion years, okay, they are living here in this planet. Wow, amazing, right? And then this microbe is more, okay, in our hands than we people living in this earth. Wow, because they are more than 100 or about 100 trillions already, and most of them are living inside our body. So amazing, right? And that is why they are influencing and managing our health. How? Okay, here we can learn that not all microbes are dangerous, because less than 5% only are dangerous. For trillions of microbes in our body, but only 5% are dangerous. That is why in this FB Live, we will learn how to manage and to put that microbes in our digestive system in balance, so that they can function, because their function influence your digestion, influence your immunity, influence your aging, influence your weight. So here we will be talking about the 4 steps that can help, okay, and make these microbes healthy, okay, especially the good bacteria in our digestive system, to stay healthy, so that they can continue influencing our health, our immunity, our aging, and especially our weight. The number 1 that can damage these microbes is one, toxins. Okay, toxins. Toxins from any sources, like for example, toxins from medications, from antibiotics, because some people are, or most people are just taking this antibiotic without consultation, without medications already. Okay, they only go to the pharmacy, and since they have prescription from their doctor, and they no longer go back to their doctor, or that prescription is from their friend, from their mother, or from the member of the family, and they use that if they have infections. My friend, my advice is you need to visit your doctor, okay? Because antibiotic can not only give you good, but it can also do harm if that antibiotic is not good for your digestion, okay? Because that can kill the microbes, okay? Second, especially these toxins from preservatives from our food. That is why you need to limit also the food that is highly preserved or preserved. Okay? Or preserved. Okay, preserved. So there are food that highly preserved. And that's why we need to minimize that also, because it can create toxins in our digestive system. And one of the highly substance or highly toxic that can be created in our stomach, according to Britannica Encyclopedia, it's what? It's nitrosamine. Okay, nitrosamine is a combination of nitrates, a preservative, okay, mostly in meat, and then what? The molecules of that is the amino acids. So the combinations of nitrates and amino acids, they are nitrosamines. Okay, one molecule. The two molecules binded together and become highly dangerous toxin. So that is why nitrosamine was considered. Okay, I don't know until now. Okay, by science research that nitrosamine can cause stomach cancer, pancreatic cancer, colon cancer, liver cancer. So that's why you need to minimize food that are highly what? Preserved. Second is the pH balance. Okay? Acid in our body can also kill what? The microbes. This pH, when it goes to negative pH, like acid, when your acid will turn to 5, 4, 3, 2, and is going down, it will also damage not only the lining, but also the microbes in our gut. So the pH is important. Okay, pH. Now, the balance of the pH is not 50-50. The balance of pH, according to Otto Warburg, Dr. Otto Warburg, the winner of Nobel Prize for this piece, is what? 80 is alkaline, 20 is acidic. Meaning, you don't need to avoid all acidic food, but you need to control the percentage, okay, the ratio and the volume of that acid. So if you just drink soft drinks, just little. But sometimes when you see soft drinks, you cannot control yourself, right? So you drink all the bottle, what's in the bottle, right? So control it. If you can control it, then you can live a normal life. Because most people, their happiness is drinking soft drinks. The 80% should be what? Alkaline food. Alkaline are more on vegetables. Alkaline are more, it's not only about food, it is also about your thinking, your thoughts. Sometimes we have these acidic thoughts, we have this acidic personality, we have this acidic friend. Try to avoid them because you'll become also acidic. So try to avoid that. According to the study, alkaline food can what? Fertilize the microbes in our system. Then step 3, okay, you manage the toxins, you manage the what? The pH level, okay? And then third is you need to manage fats, because the fats, when it increases fast, okay, it's a sign that your microbes is also degrading. Meaning it's a reverse, right? Reverse flow. Because your fast is, when your fast is increasing, your microbes is also decreasing. So you need to manage and to check your weight. Okay? It is not only that you need to check your face, your eyes, your ear, your nose, and your teeth, but you need to check your weight. If it's increasing fast, then you need to check your what? Your digestion is already affected, right? Can you imagine when your weight is increasing because of the excess fats? Then you will experience what? Bloating, gas pain, right? And acid reflux, yeah? So, fats, you need to manage the fats, right? You need to manage the fats. And lastly is what? You need to, what? Know your aging. Since you are already watching or looking at the mirror every day, right? Before adding makeup, okay, to your face, you need to see what the texture of your skin, because it shows something from the perspective of your stomach. Because the absorption, when the absorption is hindered, it means that your digestion is not good. It means that maybe some toxins is staying in your stomach. It means that the acid is already increasing in the stomach, right? That is why fats or the aging will be affected. So that's the 4 steps that you need to look at in taking the health of the microbes. Here's the bonus. Number 1 is that there is a what we call the prebiotic and the probiotic. But let me make it simple to you. Prebiotics are the things that fertilizes the microbes. Meaning the prebiotics, is like food to the microbes. Without this prebiotic, then the microbes become hungry. So their growth, their balance will be affected. Meaning prebiotic is needed. And what is this? What are these prebiotic? These prebiotic are complex carbohydrates. These are fibers. Fibers. Like for example, green leafy vegetables, or fibrous like psyllium husk, right? Like beans, like grains. So you need to add that in your diet to fertilize the microbes. Maybe they will be injured by the toxins, they will be injured by the pH level and the fats that we are eating. That is why we need not to to forget these complex carbohydrates, right? Grains, nuts, and also the fiber. Fiber is important to fertilize. It is not only that you need to take this fiber so that you can cleanse the colon, but aside from that, the most important role of the fiber is to fertilize. If you are fan of farming, and most farmers spend most of their money in fertilizer, right? So they spend more in fertilizing their crops. How about your microbes in your digestive system? Are you fertilizing them by eating this complex carbohydrates, right? Like me, I cannot forget, and every week I need to really include shake of phytofiber in my diet. Why? Because it's composed of psyllium husk and prebiotic and also probiotic. So how about this probiotic? Probiotic, in a simple term, is that probiotic is the food that are fermented. Fermented. Like kimchi, kimchi, like yogurt, there are fermented food. And many or most people, I think, forget spirulina. Spirulina are considered probiotic. Let's go back from the beginning. The second brain is or can trigger 90% of our health. These are immunity, digestion. Digestion is very important in nourishment, like in nutrition, because even if you are eating good food, if the digestion is not good, then sometimes when you eat vegetables, you will say to yourself or to your friend, I have indigestion when I eat vegetables. So your decision will now what? Be, I will not eat vegetables because I have indigestion. But the problem there is the what? The one that help your digestion okay, which is the microbes, the gut microbes. Okay? And then also what? You need to help these microbes to be balanced and to live longer with you, because they are what? They are there, okay, to help you. I have a book, okay, Living a Healthy Lifestyle, and imagine this chapter 7 talks about the seed of healthy lifestyle. So would it be okay if you try to read this? Okay, try to read this book. Okay, and we have the pain framework. If you want to avoid pain, okay, like chronic pain. Chronic, when we say chronic, is passive, right? Chronic pain, like arthritis, hypertension, diabetes. If you want to avoid, right, or prevent that to happen in our health, then would it be okay if you can make this as your reference book for healthy lifestyle? Okay, contact us in 0915-342-5208. This is Dr. Dorwin Lajot, your health contractor, and assalamu alaikum. Okay, all glory to our Almighty. And this Sunday, may the Almighty bless you and keep you safe and bless you and grant your health.